Welcome to Deuk Spine Institute. Our patient travels from Minnesota for sacroiliac joint dysfunction and pain in his left SI joint. He's an athlete. He knows all about SI joint pain, and it turns out that the doctors that treat SI joint pain typically want to do a fusion, but these fusions don't work. That's why we don't do them at Deuk Spine. They just came out with a study from Norway that shows that SI joint fusion just doesn't even work. People that get it done, their pain never goes away, shot, or comes back. All right, so we're going to do a rhizotomy instead here at Deuk Spine. This patient did not want fusion. I don't blame him. I wouldn't either. Shot. Long story short, the SI joint or sacroiliac joint is a typical diarthrodial joint. It has two cartilaginous surfaces, and it is frequently affected by arthritis. And the people that get it, they have horrible pain in their SI joint, like he does. Shot. So I've got to get down to where the joint's nerve supply comes from and treat it. That nerve supply comes out of the sacrum or tailbone. Shot. And runs from these little holes right where the tip is. If you see the tip, you can see one of those holes. And they run from those holes over to the joint. And what we try to do is disrupt the flow of painful information by severing those pain nerves. Hold on. Cutting them, basically, before they get to the joint. That's really what we do. It's not rocket science. It's actually pretty simple to understand. If you cut off the supply chain, then you end the transmission of information, sensory information from the joint to the brain. And that's what we're doing. Now, are we the first people in the world to do this? No, by no means. Sacroiliac joint, thank you, Luis. Rhizotomy has been around for a while. The problem has always been that it doesn't work because the tools that are being used by other doctors, like the radiofrequency ablation probe, just doesn't work. So we pioneered a new technology here at Deuk Spine that was more powerful, called the Deuk plasma rhizotomy. And that's what we do. Relax. Any questions?
Yes, we have a question coming from Marwin on YouTube. Marwin asking, what is the wavelength of the laser?
Shot. Okay, Marwin, hi. We're not using a laser for this procedure, but the wavelength is 420 nanometers when I do use the laser. It's a holmium YAG laser manufactured in Israel, and it's literally the best medical laser you can buy. 420 nanometer is the wavelength. Shot. All right, I think I'm just about done here. Let's show the audience our video on SI joint DPR.
Of course.
And I'm just going to be done in a few minutes.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK.